Welcome to the QPL Baby Learning Series, a partnership with Elmhurst Hospital and Queens Public Library to improve early learning and health outcomes for children aged 0 to 3. My name is Christopher Galarza, and I am the Community Health Educator at QPL, and today I am joined with Dr. Friedman, an obstetrician gynecologist at Elmhurst. Today we will discuss contraceptives and sexually transmitted infections. So thank you for joining me, Dr. Friedman.
Thank you.
I guess I just want to start off broad. What is contraception? What are contraceptives?
Contraceptives are agents that are used to prevent pregnancy. They are highly effective in most cases, and there are a broad range of contraceptives available depending on a woman and her partner's choice.
Great. And so what are some of those different types of contraceptives?
Well, we have hormonal contraceptives that can be broken down into the traditional oral contraceptive pills. There is something called a vaginal ring, which is a contraceptive hormonal device that gets inserted into the vagina. There are injectable contraception, something called Depo-Provera. There is also an implantable little contraceptive plastic rod that gets inserted into the arm. It's a very small device that's barely detectable. In addition to that, there are barrier methods such as condoms. The vaginal sponge is occasionally available. It's hard to find. There are, in addition to condoms, there are diaphragms. There are intrauterine devices, and those can be divided into two types. One type is sort of the traditional one made of copper, and the second one is made of plastic and contains a hormone that's released slowly into the local uterine lining. In addition to that, there is a new medication that's sort of a film substance that changes the amount of acid present, the pH in the vagina, that is an effective contraceptive agent as well. And of course, there's always abstinence, which is probably the most effective but less practical.
And are there certain types of contraceptives that are recommended for certain types of people, or,
Yeah, that's best discussed with an individual provider. Some individuals do have medical problems that might interfere with one of the methods. Individuals who are particularly sensitive, for example, might not do well with placement of an intrauterine device. Those do have to be inserted by a caregiver, but once they're in place, they can last anywhere from 3 to 10 years, depending on the model that's used. The contraceptives such as the sponge or the vagina, or the condoms do make it necessary for the couple to use them, otherwise they won't work, whereas something such as implantable devices, injectable, will work sort of behind the scenes once they've been administered. The pill is a very good method of birth control. It has some non-contraceptive benefits which are very important, but in order for it to be effective and to limit the side effects, it is something that has to be taken every day.
And along with contraceptives, one of the things that we speak about regarding intercourse is, of course, sexually transmitted infections. Can you just talk about some common STIs and, what are the symptoms and things like that?
Yes, well, sexually transmitted infections is obviously a topic on which we're very much aware. Some people think that sexual relations are only for a baby, and they neglect the fact, so they might use a contraceptive agent that doesn't prevent sexually transmitted infections. For example, the condom, while a reasonably good, effective method by itself for birth control, is also the only method that will prevent sexually transmitted diseases. So we're worried in particular about gonorrhea and chlamydia. Those can sometimes be silent in a woman, although more often than not it will lead to excessive discharge, can lead to abdominal pain, pelvic pain, and unfortunately can lead to sterility if not addressed and treated properly. Men will often have a discharge through the penis if they have gonorrhea or chlamydia. They can get an infection in some of the tubes that go from the testicles outward, and they might have pain there as a result. Fever, pelvic pain, always a reason to seek evaluation and treatment. In New York City, unfortunately, as well as some of the other major cities in America, syphilis has been rising, and congenital syphilis, meaning the baby has been exposed while inside the mom, is a very serious condition. and we screen all of our pregnant patients for it, as well as individuals coming to the clinic, especially adolescents and young individuals, to verify that they haven't been exposed. There are several other sexually transmitted diseases that are a little bit less common in America, but they tend to be more common, and with our population in Elmhurst, we do have to be aware of them. Things like lymphogranuloma venereum, granuloma inguinale are less common typically for us to see.
And can you speak about the different types of screenings for STDs?
Sure. Whereas traditionally cervical cultures were about the only effective way to screen for gonorrhea and chlamydia, now actually a urine sample, so it's non-invasive, can be performed, and it's a much more comfortable for individuals to be screened. Syphilis is a disorder that typically is made by a characteristic rash and blood test for confirmation. The other disorders that I briefly mentioned typically involve a swabbing of the area. I don't want to leave out two very important sexually transmitted diseases, herpes and also human immunodeficiency virus, the virus that causes AIDS. Perhaps the most common sexually transmitted disease worldwide is actually the human papillomavirus. The human papillomavirus can be divided into two main categories. The first is sort of the low-risk types, which are typically causing warts. The other are the high-risk types, which are associated with the vast majorities of cervical cancer. With the advent of a vaccine that can prevent human papillomavirus with excellent effectiveness, it's likely that we could actually decrease dramatically the incidence of cervix cancer. And that's available for adolescents, male and female, ages 11 onward. And recently, in the last few years, it's also been approved for women up to age 46.
And can you speak more about some new preventative ways for HIV? I'm thinking of like PrEP and PEP and things like that.
So yeah, PrEP is the concept of giving pre-exposure prophylaxis. The tradition was always, if someone got exposed to a disorder such as HIV, they could take post-exposure prophylaxis to prevent that. However, with pre-exposure prophylaxis, if one is known to be at high risk for exposure, they can take these medications ahead of time. And these also are very effective. Of course, we would always recommend practicing safe sexual contacts. The last STD that I didn't mention is hepatitis. Hepatitis B and C are typically from fluid exchanges, as is HIV. Hepatitis A is typically a foodborne disease, but actually with certain sexual behaviors can be encountered sexually as well.
And then can you speak about, let's say you see your provider, your test result came back reactive. What are your next steps now once you've been diagnosed with it?
So New York State has been very proactive in the treatment of sexually transmitted infections, and they have passed a law that states that a provider can treat the partner so that expedited treatment can be conducted, thus help limiting the spread of these disorders in the population. Anyone, male, female, non-binary, anyone who suspects that they may have been either exposed or knows they were exposed to an STI should definitely seek help as readily as possible, because the earlier the treatment is enacted and the evaluation is conducted, the more likely they will be cured, and as a result, the fewer complications they could have later in life. For some of these, we have treatments, some we have cures, and some we have preventive measures, which is probably the best way to prevent anything. As Benjamin Franklin said, an ounce of prevention is worth a pound of cure. The earlier and the more effective we are in preventing STIs, the better the results will be.
Great. And just to wrap up our conversation, what's one or two things that you would say are really the take-home messages when it comes to contraceptives and STIs?
Until one is ready to start a family, I would recommend using contraceptives and speak to your provider in order to decide which one is best for you. And in terms of preventing STIs, I would say until you're with a partner who will be mutually monogamous, barrier methods in addition to Other methods of contraception, which might be a little more effective, should definitely be used. And I would recommend condom use in that setting, with possibly, depending on the individual's preference, birth control pills, an intrauterine device, any of those long-acting reversible methods of contraception, such as the injectable, the implantable, or the intrauterine device, are excellent methods for long-term yet reversible contraception. We didn't talk about sterilization, but in younger patients, I would prefer that conversation be limited to highly specific circumstances.
Great.
And as a general rule, whenever someone feels that he or she has a symptom and she's not sure what it is, especially pain and fever, care should be sought immediately.
Great. Thank you so much.
You're very welcome.
Yeah,
Thank you.
And I want to say thank you, and we'll see you guys next time.